you told me a very sad story about how you were before the surgery. Tell me, how was your life before the surgery? When did it start? What was the path you took until we met?
Well, it was crazy. I'd always take on more than I probably should have. I worked out, I had foster care in my home, and I also ran a household. And, you know, it was getting harder and harder to do those jobs. And I would work until I almost dropped, or I was in so much pain I wound up in bed. I would get everybody situated, and then I would go rest, and I'd have to start that at 6 o'clock probably when I got supper done.
Yeah.
And it was really difficult to
You had lots of pain.
lots of pain.
When did you start having pain? Well, do you remember, how many years has it been?
Oh, it's been a good 10.
Yeah,
10
you told me
years.
when, in 2008,
Yep.
you start noticing that the pain is getting worse, and then over the years, obviously, it really stopped you living your life.
It did.
Oh, tell me about it.
I couldn't reach down into the wash machine to pull the clothes out to get them in the dryer. I was trying to get groceries in from the car. I started looking at the steps to get the groceries. First, you gotta go to the store, get them in the car, get them in your cart, put them out on the table for the checkers. Then you have to get them, when you get them in, put them in your own trunk. Then you have to get them out of the car into the house and put away. Well, that exhausted me. I was in bed between grocery putaways.
But what moved me really, the story you told me about your granddaughters. Tell me that story.
Well, I had the granddaughters over. They'd come for hunting, and I was kind of just expected to do whatever grandmas do. And I realized I couldn't play with them anymore. I had to go lay down because my back was so sore. And they were in the living room with their dolls piled around them, and I said, Grandma has to go lay down, but I'll be right there. I could hear them laughing and playing because our house isn't real big, and I felt so bad that I wasn't able to interact with them. I wasn't there watching their giggles. I was in the other room. It felt very remote, and that's when I kind of lost the luster for wanting to live.
Yeah.
And I could feel myself, if I'm just going to be a vegetable in bed, I'm losing out on all the stuff I could do with my grandkids.
And it is very brave of you saying that, being able to say that, and people who don't have the pain, they don't really understand. I have myself back pain. I know how it is sometimes that you cannot turn an inch, and that really you're truly bound. And
it takes away the brain, and the pain constantly starts to debilitate your thinking for right and wrong. I mean, I actually thought I would take my own life because I didn't want to be that burden on my family. I didn't want to be that burden. There was no answers. Every time I went to the doctor, it was, well, they can't do anything, or they give me a pill, or I did get one doctor to give me a shot that relieved the pain minorly on the surface, but never deep enough.
And again, thank you for sharing it, but in your case, it was more concrete than that. You said you were collecting pills, that if it becomes even worse, that you would be, truly executing on that thought. So, and I'm happy you didn't, because, finally I think, we could find a way for you out of this.
Well, I was quite surprised that you were able to go in and find something to put in there. When I saw that on the CT scans that they were rubbing on each other, and I wondered why I felt like my bones clicked, and when I walked I could feel bones clicking, and it hurt when I'd walk.
And your situation wasn't a questionable thing. You had a scoliosis, you had a big scoliosis. And
I didn't know that until I met you, actually.
But I think, without calling names, but you have been told you are too young for that surgery.
I was told I was too young.
And the surgery was too big.
I was too big, too expensive. I was in between work one time, and I come because I was in such pain, and I was told they weren't able to look at me, because I was poor.
No, and and you are neither too young, nor too old, nor poor, but the problem was that I think the surgery itself was such a big surgery, such a damaging surgery. And in your case, you had a thoracolumbar scoliosis. We knew that. we got a discogram, which is a painful study, not to prove that you have a problem, but to try to see, can we do a smaller surgery and give you relief?
Oh.
And that discogram told us that, you know, we don't have to fix everything. In the first surgery, actually what we did, we fixed the 4 of the disc, L1 to L4,
Yeah.
and that was 2 years ago.
Yes.
So now tell us, you know, what was that surgery that we did 2 years ago, the first surgery? How did that go? How did you improve after that surgery?
Well, it was slow.
That was a big surgery.
Yeah, it was a big surgery, and there was times I didn't know if I was going to make it through that, but I had some motivation.
Mm-hmm.
Of course, the grandkids were always a motivation, and it was one day at a time.
One day at a time.
But after the bones started to grow, I realized I would start to do too much, and I was hurting more.
Mm-hmm.
And then we talked, and you said, well, if it hurts, stop,
Mm-hmm.
don't do it, and don't do it anymore.
Mm-hmm.
Well, I took that literally, and I started looking at what I was doing, and I realized it was a slower process than I thought. So we kind of worked at that. I worked at that slower, and it did get better.
Yeah.
And for a year, that whole summer, I completed more stuff. I got to enjoy my grandkids. I started quilting and making them each a quilt, and doing things I enjoyed doing. But as things progressed, I started having all these pains, and it was nerve damage from the bottom. It was crushing some of the nerves.
The one level that we didn't do the surgery.
The one level we didn't do.
See,
and the pressure must have, well, that's what I was explained too, that the pressure was getting so, the 4 were doing their job that were fixed, and they were, because I wasn't having stabbing pains out my back that I couldn't explain. Those were gone, and I said, that worked, but something else is wrong, and I came back to you then.
Now, if you remember, we knew from the start you have so-called thoracolumbar scoliosis, and some of my colleagues say, do it all at once or don't do it at all. What I say, and I have a data to prove that, is that if we deal with the worst part, half of the people don't even have to go through the second stage. In your case, we had to go through the second stage just 4 months ago. And you just told me that that pain, that notch that was in the back, that is gone now. Tell me about it. How are you now, just 4 months after the second stage of scoliosis correction?
Well, I'm a lot better. I had a lot of pain to this point where my leg was almost numb. I thought I was going to lose. I had actually asked the doctor, am I going to lose this leg? Because I couldn't put pressure on it anymore. I couldn't walk up the 3 steps I needed to walk up. But after that last surgery now, I haven't had any pain in this leg. The numbness and the achiness is gone, and I don't get cold like it was.
Are you getting slowly back to the level of activity that you think is okay for you?
It's a little early. I kind of want to push it a little bit, but when I look back at what I've done in 4 months, I certainly have done more than I did the first surgery in 4 months. I was just kind of coming out of it, moving around a little more after the first 4 months. This time I'm moving around, doing stuff. I'm going to activities. I got active in a garden club, and I'm active in Our Lady's Aid and things like that. So I wasn't doing that before.
Things are going forward.
They are going forward.
I'm going to, if you don't mind, please, if you can come and concentrate on this piece of paper. This is what we talked about, and I'm going to show you again. If this is our spine, 100% activity of our spine, and this is when we are born, we have very little function. Hopefully when we die, when we are 110 years old, obviously then it has no function. So it goes from 0 to 0. We talked about that the maximum activity of the spine is around 10 to 15 years old. That's where the Olympic gymnasts are. And after that, it goes down. Now the problem you had is that all of a sudden you have a problem here and you fell off the cliff. And if you don't walk, you told me that you were losing function. You didn't want even to live. You wanted this to end, the pain to end. But it's more than that. Your heart shuts down, your lungs, your capacity shuts down once you have a spinal problem here. Now, you went through, told me, about 7-8 years.
Yes.
7-8 years before, we went through the procedure.
Yes.
we brought you back up, and then you fell off again because you needed the second part of the
Right.
surgery, and you are now coming back from this. This is the first surgery, obviously. This is the second surgery, and our goal is to make you along the natural curve of how spine behave, make you a normal person again. And obviously, with some of our protocols, we can put you actually above where normal people are, because now you got exposure to physical therapy and so on. Now, obviously, the expectation is to make your spine behave the way it's supposed to behave, and you not lose all these years that you couldn't attend the graduation of your grandchildren or game activity with your family and so on. This is all the family life that people lose.
I couldn't sit anymore on the bleachers. I couldn't sit on any solid material.
For the normal surgery, many of my colleagues wait a long time because this surgery is risky.
Yes.
Because what we do is less risky. We put you through our protocol, we do physical therapy, but we can catch you much sooner, so you don't have to lose. If I would have seen you sooner, we could have done the surgery for you without you losing all these years here. Now, to be realistic, obviously it's a path to go there, and I cannot make you from here go back again being at where you were with 40 years. That would be the so-called Benjamin Button curve, or be getting younger with 70 being so old as you were 40. That's not realistic. But we have been very successful. Not only wait 8 years before we do the surgery because our surgery is less risky, we do all our conservative management, and this is what we did. We put you through everything, not over years, within few months.
Yes.
And then once we know it's not working, we took you. So this is where we met. So just few months before the surgery, and then once we maximized everything, we did the surgery, and this is the knowledge that's missing, that there is a surgery that can be done before you decondition, before your heart and lung shut down, before you lose your willingness to live. And that is, I think, what my colleagues need to know.
Well, I really wished I would have known her sooner, because I did miss out on a lot of life.
Yeah.
And to the point where I did feel like I was ready to give up.
We are not exactly where we need to be, but we are only 4 months out of the second stage of this big surgery. So we have a long way to go. And everything you tell me I was expecting to hear, and you are on the path to get to a normal curve. And but it's going to continue getting better. We just look at the films. Most of your scoliosis is corrected. Everything is in the right place. Just after 4 months, your bone actually start to grow. So I'm very happy with what I see on the films, and I'm very happy with the clinical improvement, which you're telling me that sharp nagging pain is gone and activity is returning and so on. Now, and I'm very thankful for you sharing your story, because for many of my colleagues is, your surgery is too risky in my office. Just get out of my office and, have decondition somewhere else. Your heart may shut down, but at least it won't be your problem, wouldn't be in my hands. So we do sometimes, unfortunately, the safe things, what is for our practice, rather than doing the safe thing for the patient, because truly the open old-fashioned surgery can be very risky.
Right.
By us being able to reduce
Well, I
that
was
risk.
scared to do the old-fashioned surgery,
Yeah.
actually, because I didn't know. I think it helped that I was able to see what was going on. You were able to point out what was going on and what was happening. I could feel that you were in my body, that was right, because that's where the pain was.
Yeah, it was.
And I never, I didn't know the significance of the nerve pain that went on with the back pain.
Yeah.
Why would I get a soreness in the numbness in the cheek of my butt? And then it blossomed into so bad that it was so, I just wanted to be gone.
Yeah, and that is, I think that patient education, that's what a crucial, important role it plays in this communication, for you to truly understand what's going on inside of you. Take the mystery out of it.
Right.
And you are not a medical mystery.
You're right about the part where, when we could link up what you said, I could feel it in my back. I knew that was the right procedure, and that's why I came back. and continued because somehow I felt this was right.
Well, thank you so much for sharing your story. I
Yeah,
really
you're welcome.
appreciate that.
Yes, you're
Okay,
very
thank you very much. Thank you.